I injured my ACL tumbling back when I used to cheer and tumble and be active with all that stuff. And then a couple years later, it started giving out on me, and I hadn't actually known that it was torn. Started buckling and giving out, which with my job is very active, so I needed it to be a little bit more sturdy. So I came in, they told me it was torn, and like 2 weeks later I had it repaired by Dr. Murray. I was a competitive gymnast from the time I was 7 years old, and stayed active with cheerleading after high school, and kept tumbling, kept being physically active that way, and then while performing a tumbling skill, I tore my ACL. I actually did internet research in order to find Dr. Murray, and like I had said, I found that he was the sports doctor for the football team at the University of Tennessee. And since I attended University of Kentucky and am very aware of the high standards of doctors for the SEC football programs, that kind of sold me on coming to this facility. The part that made me the most comfortable, that I enjoyed the most about coming here, is that it just felt like everyone was in tune with each other. Everyone knew what was going on, from the personal or the physical therapists, the doctors, the staff. Everybody was kind of on the same page, which kind of made me feel a little bit more comfortable about knowing that my physical therapy was being done the way Dr. Murray wanted it to be done, so I was on the right track the whole time. My experience here at Core Orthopaedics has been great, from Dr. Murray, from the surgery, from the pre-consultations to the post-consultations. My physical therapist was great, so the overall experience was just fantastic. Anybody experiencing any knee issues or any issues in general, because my mother also has had work done here, I would recommend Core Orthopaedics, both Dr. Murray and their other staff and representatives, to anybody. I work at a cheerleading gym as well as own my own company for choreography. I coach a lot of tumbling and stunting skills, which before I had my surgery, I was limited with some of the things I would be able to demonstrate to my kids and to my athletes. And then once I had the surgery and had gone through a successful physical therapy, I was able to jump back in on those things and was a lot more able to do my job effectively. I feel like I'm back to 100%. I still feel some of the residual effects from the hamstring, just because they took a piece of the hamstring, and I lift legs a lot. I like that part of it. So it's still not 100%, but I'm close.